And everybody. I'm sorry. No, I'm going to talk about stuff.
And everybody, okay.
No, anyone. Should I go? Postnatal is when you deliver from delivery to 6 weeks.
Okay.
That's within the postnatal period. And depending on. I hope this part is cut off. Anyways, depending on the mode of delivery you had.
Can start so that when he's cutting.
It doesn't matter, you can play it.
Okay, so Dr. Gifty, this question I'm about to ask you, I don't know if, yes, it's very, very important to me. I want to ask, is it really, how did the thing go? Advisable pill?
Hey. Mabina.
So Dr. Gifty, with this question, it's very, very important to me. Is it advisable to breastfeed your child immediately your child comes out?
So what the World Health Organization states is that you're supposed to breastfeed 30 minutes, within 30 minutes of delivery.
Hey,
yes,
my little Yemoh.
Don't worry,
I
I
really
know.
stabbed you.
So for first-time moms, and even for multiparous women, I mean women who have given birth to like 5, 6, 7, 8, some people still don't get the breast milk coming within that time or within that short frame. So what we advise is that we put the baby to breast when the baby comes out. Imagine you're delivering vaginally. Immediately the baby comes out, we put the baby to breast. And then that is to sort of like stimulate the breast milk production.
Okay.
It's a negative feedback. Once you keep doing it, they stimulate the brain, then they will start coming little by little.
Okay.
So that's the best thing to do to breastfeed. Breastfeeding is very, very, very important. I know there are lots of, it's a whole topic on its own. There are a lot of important things you should note when it comes to breastfeeding. Maybe some other time you can do breastfeeding and the importance or how relevant it is. But that is very key. Breastfeeding 30 minutes after delivery, ideally within 24 hours when the child is born. Okay. However, most mothers, like Ejiwa,
I was about to ask you,
didn't have it that way. It couldn't come. The breast milk just couldn't come. No matter what she did, it wasn't coming. So what we start is we start them on supplementary feeds. We start maybe NAN1 or SMA or something. But some mothers who don't want to breastfeed, because I think there's this notion that when you breastfeed, your breast falls, or there's something like that. So some people don't want breastfeeding. So those people, they do like complementary feeds. They feed only on NAN, SMA, those kind of things. So I mean, that is what they want to do. That's also not bad, but I always go for breastfeeding. And besides, breastfeeding helps to bond with the mother. It also helps, it contains an enzyme, so it can help prevent some conditions. For instance, if your breast milk is not coming, your baby might be jaundiced. Yeah, so breastfeeding was jaundiced, because the breast milk wasn't coming. Yeah, so breastfeeding is very important. I cannot overemphasize on how important breast milk is. So yeah, try putting your baby to breast every time, irrespective of whether it's coming or not. Just put the baby to breast. And once the baby is sucking, they will start producing little by little.
Okay. Dr. Gifty, there is a general perception that doctors are very cold in attitude when it comes to women during delivery. How true is it?
So, this is a funny
Why you
No, so every person relates to or reacts differently to pain. I mean, some people will go through labor. They'll be lying down quietly. They'll just be doing this. And then they are cool. Before you check, they are 10 cm dilated babies.
But it's not easy.
It's not easy. Yeah, that's what I'm saying. That everybody reacts differently to pain.
Yeah.
So for someone, most of the time it's the first-time moms, and first-time moms have longer labor than some. It doesn't happen for all though, but most of them have longer labor. So if you are going through pain, you don't listen. Most of them don't even listen to anything. No instruction. That's not why you are not going to tell the mother to lie down, do this. They don't even listen, because the pain they are feeling,
it's not them.
I can only imagine. So yeah, and it's unfortunately in Ghana, not all health facilities go through or do epidural. So epidural is a pain relief sort of that we give to mothers in labor. and then it depends on the skill of the doctor or whoever. Most of the time it's done by anesthesiologist, or some anesthetics to also do it.
Okay.
But ideally, in developed countries, anesthesiologists. In Ghana, so far where I've worked, we don't routinely do epidurals. Maybe one special case, then maybe do up to epidurals. And then you can imagine it will be very expensive. But for the typical Ghanaian woman or whoever who doesn't want any epidural, because of course every procedure, every medicine has its complications. So some people don't even like they just don't want it. So if someone is going through pain, and for instance you are my patient and you come in and you are, let's just say, 2 centimeters that day, you really know that you're 2 centimeters. I mean, you've been having the pain for like 2 days in the house, and you came and I checked, I'm like, you're 2 centimeters, like, only 2 centimeters. Your first reaction is that you'll be annoyed at me, as if I'm the one who's supposed to cause the dilation. But no, I don't cause the dilatation. So some of them are very, very rude to health workers, not just doctors, because honestly, those in labor or even before, we establish labor when you're from 4 centimeters.
Okay.
So from 1 to 4, you're not really in the active phase of labor. But those in labor, some of them are really, 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 you guys should be there. So, and for a doctor, you don't really spend much time with the patients. I mean, we see different people at a time, but the people that they spend a lot of time with is with the midwife. So depending on the kind of midwife you get, some are very patient. I mean, some are very understanding. They'll encourage you, they'll tell you to lie down, relax,
They'll be pumping you.
Yeah, they'll rub your back, they'll do this, they'll do that. One person cannot sit by you and be rubbing your back. The best they can do is they can tell you that, you get better or something. The midwife sees that if they pamper you too much, something might happen to the baby, something might happen to you. And labor, anything can happen. Anything can happen.
Guys, I told you.
Anything can happen. I'm sorry to scare the first time moms. I'm scaring myself because I'm not there yet, but anything can happen. Yeah. So you just have to listen to the instructions that has been given. As for the niceness of the doctors, you can get a very nice doctor. You go through labor smoothly. You can get a very nice doctor and still not go through labor smoothly. You can get a mean doctor, go through labor smoothly. And the thing is that when the woman delivers, actually they appreciate those who were a bit harsh on them.
Okay.
Yeah, because it makes them sort of realize that this thing they are in is critical. So
okay.
Yeah, but we have nice doctors. I know you saw Dr. Senor in one of the vlogs.
Yeah.
He's one
on
of
my
the
couple channel.
He's one of the nicest doctors you can ever get. So yeah.
Hi, please.
No, I'm a
please
nurse,
your name.
and she's the doctor.
No, you are not a nurse.
Really?
You're a doctor.
What if
I remember when we came, you were sitting there. Please your name.
I'm Senior. Dr. Senior.
Senior. Yeah.
Typical
F1. Dr. Gifty.
Yes, please.
Okay, our new friend. Dr. Gifty is so friendly.
Am I? Hey. If you know him, you can call him and congratulate him. He's a very good and very patient doctor.
So guys, we are done with the prenatal, postnatal, and antenatal. We are done with it. So we are moving on to cesarean section. The almighty C-section.
It's not that bad.
Oh, okay, Dr. Gifty. Okay, so what's your take on cesarean section?
Okay, so
and is it advisable for you to opt for a cesarean section?
That's a tricky question. So for C-section, I mean, some health personnel, some of my colleagues now, they opt for C-section. I mean, that's easy for them. You just go after like 30, maximum 45 minutes, you are done. However, it takes a longer time to heal. With cesarean section. That's one of the downsides, or let me put it that way. And then maybe some people don't like scars. Even now, the cesarean section,
like me, I don't like scars. I really don't like it.
Now the suturing is like peninsula incision. So sometimes you don't even see that there's an incision. Okay. Some people do a very fine job.
There's a cut.
Sorry.
You don't see that
there's a scar or anything. You don't see it. My take on cesarean section personally, that's a tough one. Because I feel like if you can go through vaginal delivery, if there's no contraindication or if there's no reason for a cesarean section, you can just go through the pain. At least vaginal delivery, the wound heals faster, depending on whether you had an episiotomy, an incision, a cut down there. To when the baby's coming, sometimes the head can't really come through the
vagina.
Yeah, so they make some incision, and that's what we call episiotomy. If you didn't have which even heals faster than a cesarean section, yeah. So ideally, if there's no contraindications to vaginal delivery, please always opt for vaginal delivery. However, if you've also had bad experiences with vaginal delivery, or you just don't like vaginal delivery, you don't want to go through any pain, you don't want to go through anything, cesarean section is the way to go. I mean, it's very painful that sometimes you see the woman would have gone through labor till 9 cm, sometimes 10 cm. They don't have the edge to push, and you have to go and section them. You've gone through the whole pain. Yeah. So some people just don't want to go through that. I mean, why would I suffer and get to 8 cm, 9 cm, 7 cm, then to say, oh, the baby is not progressing, or the head is not really descending again, so let's go and section you. So they all have their own thing. I mean, vaginal delivery, you go through pain, a lot of pain before the baby comes. If you are lucky to have an epidural, that's super. Even with the epidural, you still feel the pressure. So don't think epidural does everything. It relieves the pain a bit, but you feel the pressure. So some people prefer vaginal delivery. It heals faster. You can go back to anything you were doing. I mean, no scar, nothing. Some people prefer cesarean section. Oh, no pain. You are just there. You book you today. Come, let's take the baby out and all that. Yeah. But most of the time, the cesarean sections we do in government hospitals are those who actually need it. Like someone who has had 2 previous cesarean sections, you can't let the person go through vaginal delivery. No, that's contraindicated. We will never even let that happen. And those who have severe chronic hypertension, those who have diabetes, those kind of things. There are some conditions that we want to do a cesarean section for, or you want to induce vaginal delivery. But yeah, it depends on you. You can just read about it. You can ask other people of their experiences, but never take someone's experience to be your own. Yes, everybody's experience is different. And cesarean section is not a taboo. It's not a crime. As I was telling you, most health personnel go through cesarean section now. They don't even, there's no indication, but they just want it. So we call that maternal request. I just want to have a cesarean section.
Okay, so now
it's an everyday thing.
I won't feel shy to say I had a cesarean.
No, I mean, no, it's an everyday thing.
I used to feel shy to tell people I had a cesarean section.
I know some people have mentality that cesarean section is bad way of giving birth or something. I mean, we had instances where we saw that this patient has to go for a cesarean section, and of course they'll start crying, they'll start bleeding with us, they'll start praying.
I was shivering.
Oh,
I was shivering.
I mean, it's something we see all the time. But see, people who don't even have to do it because they think that's the best for them. So you just, when you find out you're pregnant and you're going for antenatal, the best you can do is that ask your midwife, ask the doctor you are seeing, and then talk about the mode of delivery with the doctor. Okay. They'll put out the options for you, which one you are comfortable with, whichever one. But for me, if there's no contraindication, just do vaginal delivery.
Yes. So Dr. Gifty, so what are we, as a woman, what are we supposed to do, the precautions to put in place for us to prevent our child from getting any diseases or infections?
I know you know I'm struggling. Because you can never say you're preventing everything. Yeah, you can't say 100% that I'm doing this, and all this I'm doing will prevent this.
Okay.
Sometimes some things happen, you don't expect it to happen. Sometimes medicine can't explain why some things happen. So there's no 100% thing like ways of doing things to prevent some. No, there's nothing like that. No, well, not that I know of, but what I know is that postnatal care is very, very important, and it helps a lot. And it's the vaccination for babies. It's also very important. You have to follow the schedule and then go whenever you're supposed to go for the vaccinations. Those are the two important things I would say that will do well with the baby. So don't think that maybe if you bathe the baby in cold water, the child will get sick, or I mean, And sometimes too, our mothers have some things that they did for us, or our grandmothers that have some things that they did for us, and maybe they bathed us with this soap or that soap and this, and they believe that it worked. I mean, if they do that to your child and it works, it's good enough. But I can't for sure say, oh, don't give your child this, don't give your child that. However, there are some things that's no for children. I mean, you cannot expect a child to start eating banku, right, or fufu, right, from 1 month of, no. But for infections, and just go to the vaccinations, go for postnatal care. If you see anything that is not so usual of a child, you just report to the hospital.
Medical.
Yeah.
Okay. So, Dr. Gifty, so please, what's your advice and your final words that you have for pregnant ladies out there and younger mothers?
And people who want to also conceive.
Yes.
Okay. So, pregnancy is a whole journey on its own. It's a miracle. How a baby can just grow in your body. I mean, science has explained a lot of things. They've studied a lot of things, but nobody can tell everything what goes on. I mean, we've studied embryology. We know from 1 week to 4 weeks this happens, from 4 to 8 this happens. No, but what I want to say is that every stage is a miracle. So enjoy the process. And sometimes it's very difficult. Some pregnancies, I mean, you get
easy.
swollen, your feet will be swollen, your abdomen will be so huge.
You can sit down.
There are a whole lot of things, but at the end of the day, when you have the baby, or God forbid, even if something happens to the baby, you still feel like this thing that you went through is something that you've never been to or gone through before.
Something.
And yeah, so it's an amazing journey, really. No matter what happens, just give glory to God and go through it. For people who want to get pregnant and they're hoping to get pregnant, keep praying that, oh God, when I get pregnant, let it be easy and those things. I believe that's the best you can do for, and maybe it should be part of preconception care prayer.
Yes.
Antenatal care prayer, postnatal care prayer. So just pray about it. Tell God how you want your pregnancy to be like, what you don't want in the pregnancy and all that, and God will do it for you. So yeah, pregnancy is a miracle. Don't be scared. Don't let other people's stories scare you. Have faith in God, pray, and everything will be fine.
Oh.
So yeah.
So we are two women of faith.
Yes, of course, faith is everything.
Yes.
But Ejewa is the mother of faith.
Okay. So guys, I hope our section has been very educative. We've taken out something. So as we said, before pregnancy, prayer. During pregnancy, prayer. After pregnancy, prayer. So Dr. Gifty, I just have something little to give to you. This is, I don't know, it's a token of appreciation. Thanks so much for coming.
Thank you. Thank you. I think I'll show you guys what it is. So it's a t-shirt, which
says
has,
that
God
is higher than all superstitious beliefs.
Which is very, very true, and has me and AJ at the back.
Yeah, so Nia and AJ is my couple channel. So if you've not subscribed
please
to Nia
subscribe
and AJ,
to their
yes,
channel.
Subscribe to it.
And then please subscribe to
this channel too
channel
as well.
Yeah.
So until next time, it's AJ Yemoh.
Bye.